لديار الله أمضي أطلق الرحلة أدخل الميقات شوقا أبدأ الغسلا ألبس الإحرام حتى أحتوي معنا وأصلي ركعتين قربة لله أقصد البيت العتيق وألبي في الطريق ربي لبيك فقد جئت من فج عميق جئت يا ربي إليك عبدك بين يديك فاحتسب لي توبة كل أعمالي عليك أتيت يا ربه إليك لبيك يا كريم لبيك حن قلبي لبيت ربي
Okay, so I'm uploading the YouTube and
لبيت ربي أطوف وأسعى سبعا سبعا
You send it to me and you
yes,
then I'll send it to Dr.
سبعا سبعا وخلف مقام إبراهيم صلاة الله وتسليم وخلف مقام إبراهيم صلاة الله وتسليم.
You got all the doctors. Oh, I see you loaded it already.
yes.
Magic, you can show Doctor what he looks like.
Oh yes, I did.
لبيك
Yes.
لا شريك لك لبيك لبيك اللهم لبيك لبيك لا
Light improvements and lighting.
Yes, I've noticed. Wow, I'm actually seeing it as a prima.
اللهم
Just shake it.
Okay.
لبيك لا شريك لك لبيك لبيك اللهم لبيك
That's very
لبيك
double.
لا شريك لك لبيك إن الحمد والنعمة لك والملك
Before each
لا شريك
one.
لك إن الحمد
Get comfortable.
والنعمة
Your chair adjustment is fine for her.
Yeah, that's fine. Right, it's not off. Fine like this, okay?
Yes.
حن قلبي لبيت ربي حن قلبي لبيت ربي أطوف وأسعى سبعا سبعا أطوف وأسعى سبعا سبعا وخلف مقام
You keep the short machine, then you go on. Huh?
Yes.
الله وتسليم وخلف مقام إبراهيم صلاة الله وتسليم لديار الله أمضي أطلق الرحلة أدخل الميقات شوقا أبدأ الغسلا ألبس الإحرام حتى أحتوي معنا وأصلي ركعتين قربة لله أقصد البيت العتيق وألبي في الطريق ربي لبيك فقد جئت من فج عميق جئت يا ربي إليك عبدك بين يديك واحتسب لي توبة كل آمالي عليك أتيت يا ربه إليك لبيك يا كريم
I followed one of
لبيك
Rabia's wellness tips, and it has to do with dentistry. Shame. She said must put little, not every day, you put gentian violet, I think it's called, purple thing that
Yes.
drop in your Colgate. You brush your teeth.
Oh, really? Does it work?
It had worked. Oh my teeth are shining. So
That's
yeah,
interesting.
the lady that Rabia she works for us, she gives her lifestyle tips on home remedies.
You mean to whiten the teeth?
Yeah.
وخلف مقام إبراهيم صلاة الله وتسليم
It's a power machine now.
لبيك اللهم لبيك لبيك لا شريك لك لبيك 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 إن الحمد
Let's rock the show.
Alright.
To be better than the others.
Yes. Yes.
لا شريك
And you've got nice teeth, MK.
Thank you so much. All right. Okay, we will begin shortly.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Mubarak Saturday morning on Radio Al Ansar 90.4 in Peter Marisburg, 105.6 FM. I am Shabnam Ismail on the Peter Marisburg Pulse Show, capturing the heartbeat of our community. A healthy smile is just the beginning, and today we're shining a spotlight on dental health, exploring the latest tips, trends, and expert advice to keep your teeth and gums in top shape. Joining me today is a dedicated dentist, passionate about transforming smiles and lives, and with his expertise in general dentistry and a commitment to patient care. Our guests will share valuable insights on maintaining optimal oral health. Dr. Shah Mohammed Iqbal Musa Ali, formerly from Pretoria, is a dedicated dentist with a passion for transforming smiles and lives. And with over 18 years of experience in the practice of private sector, Dr. Ali has a special focus on interceptive orthodontics, particularly in children. He also believes that early intervention is a key to optimal oral health, and he has witnessed firsthand the remarkable results of addressing orthodontic concerns in kids. Dr. Ali's goal is to empower children with healthy, confident smiles, and he's here on Al Ansar to share his expertise with us today. Assalamu alaikum wa rahmatullahi, Dr. Ali. It's great to have you on my Pulse Show.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you so much, Shabnam, for having me on the show.
Jazakallah for making your time to our station today, and we're going to dive straight in. So, Dr. Ali, can you enlighten our listeners and tell us why you chose dentistry as a profession and what you enjoy more about your work?
From a very young age, I always wanted to make a difference to people's lives. Dentistry, being an art and science, offers a unique opportunity to do just that by restoring teeth by restoring both function and aesthetics. It allows me to improve not only the health and comfort of patients, but also their confidence and quality of life. The ability to remove pain, prevent diseases, and enhance someone's appearance is what makes dentistry so special to me. We are able to make a real lasting change in a person's life. Scientific evidence now demonstrates a profound bidirectional relationship between oral health and systemic health. The mouth and a potential gateway for disease. Understanding the oral systemic connection empowers both the individuals and healthcare providers to adopt a more holistic approach to health, potentially reduce.
So, Dr. Ali, can you enlighten our listeners and tell us what are some common dental problems that people face and how can they be prevented?
The most common dental problem globally is dental caries, commonly known as tooth decay or cavities, rotten teeth. This occurs when bacteria in the mouth produce acids that erode tooth enamel. Another widespread and common issue is gum disease, gingivitis, inflammation of the gums, and a more severe form of inflammation of the gums is periodontitis, which involve bone loss around the teeth, and patients have mobile teeth. Other common problems: tooth sensitivity, uh, usually caused by aggressive tooth brushing; halitosis, bad breath, which stems from poor oral hygiene, gum disease, or any underlying medical conditions. Tooth loss is another common problem. Bruxism, people that grind their teeth. Malocclusion, that's another very common problem where we have crowding of teeth, we have malalignment of the jaws. So those are the common problems. Prevention is largely centered around consistent and effective oral hygiene practices. Regular brushing, correctly brushing your teeth twice a day, taking 2 minutes. People don't brush correctly. They just brush. It's important to brush the teeth. Focus on brushing your all surfaces of the teeth. The teeth has three surfaces: the front surfaces, the inner surface, and the chewing surfaces. So you've got to do this basically in modified 45-degree angle, brushing correctly, and not just scrubbing. And that's the important to brush correctly. And you need to floss. Flossing is very important where the toothbrush cannot reach in hard to get areas. And a mouth rinse, obviously, to keep the mouth fresh and healthy. A balanced diet, low in sugary foods and drinks, is also crucial, as sugar feeds the bacteria that cause decay. Regular dental checkups and professional cleaning are essential for removing the plaque and hardened plaque that becomes calculus, which can't be removed by normal toothbrush. And the dentist will obviously identify problems early before they escalate.
And how can our listeners get more insight on frequent visits, how often they should go for checkups, and what would one expect during a typical visit, Doc?
For most individuals, a routine dental checkup would be every 6 months. However, this can vary based on individuals' oral health needs. Some people with a higher risk, those that are prone to cavities, those that are wearing dentures, those that are in orthodontic treatments, would require more frequent visits. Those that have, on the other hand, those that have excellent oral health may not need to see the dentist every 6 months. We would advise them to see the dentist yearly. During a typical examination, the patient will come into our rooms. We would take the medical and dental history. We would get the patient to lie down in the chair. We would do an assessment of the hard and soft tissues. We would check gum health. We would check if there's bleeding gums. We would take explore a probe and check onto the tooth to see if there's any cavities, and and address the main complaint. So if the patient came in with a complaint of toothache and we can't identify, then we may need to take radiographs to find to diagnose problems that are not visible clinically. And basically, and then we would advise the patient and say, this is the problem and this is what needs to be done.
And what are some signs that someone may need to see a dentist urgently?
Certain symptoms warrant immediate dental attention. Severe toothache that is persistent or throbbing and not going away, especially if accompanied by swelling, can indicate an infection or an abscess. Swelling in the gums or face, suggesting a potential infection that could spread. A knocked out tooth or fractured tooth due to trauma requires urgent care to maximize the chance of saving the tooth or preventing further damage. Bleeding that doesn't stop after a tooth extraction or an injury, or an unexplained bleeding from the gums that is not related to brushing or flossing. should also prompt an urgent visit. And difficulty in opening the mouth, chewing, or swallowing could indicate a serious underlying infection.
And tell us, what are some popular cosmetic dentistry procedures and how can they improve the appearance of one's teeth?
Cosmetic dentistry focuses on improving the aesthetics of your smile. Tooth whitening is one of perhaps the most common cosmetic procedure. It effectively lightens the shade of teeth, removing stains and discoloration caused by food, drinks, smoking, or aging. It can dramatically brighten a smile. And yes, these are thin, custom-made shells which you bond over the teeth. They are bonded to the front surfaces of the teeth, and they can correct a variety of aesthetic concerns, including discoloration, chips, cracks, minor misalignments, and gaps between the teeth, creating a uniform and aesthetically pleasing appearance. Crowns, teeth that are badly broken down, you crown it or you cap it. It's a shell that covers the entire tooth, and it's basically we make your teeth more whiter with crowns. Orthodontic, patients that have crowding, patients that have malalignment of the jaws. Orthodontic treatment is ideal to correct and straighten your teeth and give you a perfect result.
And doctor, can you share a particularly memorable or challenging case from your experience as a dentist?
Okay, one that recalls to my mind is when I just completed my BDS degree and I had to go to do my community service. We were in a rural hospital, and I've been told that the only practice you get there is extraction of teeth, and which is correct. The only thing that you do there is extraction of teeth. So what happened was a 7-year-old, came in with a knocked front tooth, and the dentist said we should extract the tooth. So I went to my supervisor and said, he's 7 years old. This is his front tooth. It's a permanent tooth. If we extract it, we're gonna cause problems for this patient. So can I do a root canal? I requested my supervisor, and he said, sure, you can do it, but we don't do that, but we have the materials. So we opened up the tooth. We did the emergency root canal. We sealed the tooth, and we actually saved the patient's tooth, the 7-year-old. We recalled him 6 months later, and before I completed my community service, and thereafter it became a habit, and root canals were done in that particular setting. And I contacted my other friends to ask them what is going on, what do you all do in your community service, and everyone said it's just extraction, except in very high like military areas where you do your community service in basically more military hospitals. Root canals were done, but in normal hospital settings, just extractions were done. So this was something that sticks out, because I was able to make a difference to this child and save his tooth. Otherwise, he would have lost his tooth. And at a 7-year-old losing a front tooth, it becomes very traumatic, loss of confidence, and it's very hard to see that.
Mashallah, on the sterling work that you've done. Listeners, we're taking a short break with a soulful nasheed to uplift and inspire this Saturday morning. When we return, we'll be back in conversation with Dr. Ali, a dedicated dentist in our city of choice, sharing valuable insights on oral health and dentistry.
سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله جئت لنا خاتما للمرسلين بدر الدجى رحمة للعالمين أبا الزهراء كم أشتاق لنلتقيه وأرى عينيك في الجنة تحت النخيل فيك الجمال والأمانة والوفاء عطر قد فاح نور عمر في الآفاق سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله تزينت بك الأرض والسماء والقلب بات يهتف لك بالصلاة أحسن الناس سيد ومصطفى خير الورى صلى عليك الرحمن فيك الجمال والأمانة والوفاء عطر قد فاح نور عمر في الآفاق اللهم صل وسلم وبارك على سيدنا محمد سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله
Okay, there seems to be an issue. They're still sorting something out in Durban.
No, that's absolutely fine.
Okay.
Your family must be very proud of you. You've come this far.
Who?
Your family.
Yeah. Alhamdulillah.
Get ready to flash those pearly whites. Assalamu alaikum wa rahmatullahi wa barakatuh, listeners. On this fine Saturday morning on Radio Al Ansar 90.4 Durban and 105.6 FM Pietermaritzburg, you're listening to myself, Shabnam Ismail, on the Pmb Pulse Show with the trailblazing Dr. Cha Ali, a dentist dedicated to transforming smiles and lives. Good dental health is crucial for overall well-being, and a healthy teeth and gums not only boosts confidence with a bright smile, but also plays a vital role in preventing various health issues. Poor oral health has been linked to heart disease, diabetes, and even cognitive decline. And by prioritizing dental care, you're investing in your overall health and well being. Let's dive back as we unpack insights on dental care and oral health. Assalamu alaikum, Dr. Ali.
Wa alaikum salam wa rahmatullahi wa barakatuh.
So tell us, how does diet affect dental health and what foods are good for listeners or bad for our teeth?
Diet has a direct and significant impact on dental health. The food we eat can either contribute to tooth decay and gum disease or help to protect and strengthen gums. Foods that are bad for our teeth are typically high in sugars and starches. These include candies, sodas, pastries, and many processed foods. When you consume these foods, the bacteria in your mouth feed on the sugars and produce acids that attack the tooth enamel, leading to demineralization and eventually a cavity. Sticky foods are particularly harmful as they cling to the teeth, prolonging the acid attack. Acidic foods and drinks such as citrus fruits, sport drinks can also erode enamel if consumed frequently. Foods that are good for our teeth are rich in nutrients and help to protect against decay. Calcium-rich foods, milk, cheese, examples are milk, cheese, yogurts, and leafy greens help to strengthen tooth enamel. Fresh phosphorus-rich foods like fish proteins are important for remineralizing teeth. Crunchy fruits and vegetables, they help to stimulate saliva flow, example apples, carrots, which cleanses the mouth and neutralizes the acids. Foods with vitamin C are essential for healthy gums. Drinking lots of water, plenty of water, especially water is one of the best things you can do for your oral health. It helps to rinse away food particles and promote saliva production.
How can our listeners prevent tooth decay and gum disease?
Okay, the basics. Effective oral hygiene. As mentioned before, correctly brushing your teeth twice daily with a fluoride toothpaste using a soft bristle brush. The toothbrush, the brushes there, you get soft, medium, and hard. It's always better to get a soft brush so you don't hurt your gums and you don't be too aggressive, because aggressive toothbrushing causes the gums to recede and this causes tooth sensitivity. You should also change your toothbrush every 3 to 6 months so that you're doing it correctly. Dietary management. Limit sugary and starchy foods and drinks, reduces the fuel and acids producing bacteria. A balanced diet rich in essential nutrients supports healthy teeth and gums. Fluoride toothpaste, fluoride mouth rinses helps to strengthen tooth enamel and it makes it more resistant to acid attacks. And regular dental visits. Seeing the dentist regularly, identify problems early to avoid bigger problems. Smoking and tobacco, and limit your alcohol and smoking, as these causes, they're detrimental to your overall health and they cause staining on the teeth. And for children that are 6 years and to develop their first permanent teeth, it's important to use dental sealants, put it over the pits and fissures to seal the tooth, so to prevent cavities.
So, doctor, can you elaborate about dental anxiety and fear? So, what are some common causes of dental anxiety, and how can a dentist help patients feel more comfortable?
Dental anxiety is a very real and common issue, affecting 60% of people, with about 10 to 15% avoiding dental care completely. The main reason for this is either their personal past traumatic experience, or they've been told from other people that going to the dentist is painful, fear of needles, fear of the drills, anticipation of pain is a major contributor. Feeling of helplessness. When they lie in the dental chair, they're not in control, and someone working in their mouth can be intimidating. Embarrassment. Some people they're not happy with the condition of their teeth, and this brings fear and anxiety. So we as dentists, how can we make patients more comfortable? We have we can do a lot by explaining to the patient. When the patient comes into our rooms, we need to start small. We need to get the patient to be comfortable, explain to them what's going to be done, how we're going to go about doing it, explain to them the procedure and why it needs to be done, and how can we. So this already will make the patient feel more comfortable. And if bringing in someone supportive to be with them, So they will make them feel also more comfortable. Distraction techniques like if they're scared of the sounds, put on music or put on the TV. That could make them more relaxed. We just need to make them more relaxed, and also applying a topical anesthetic before actually giving the injection would obviously help.
And what options are available for dentists who experience anxiety during procedures? Do you sometimes get patients come into your rooms and you'll see this bit of anxiety, and how do you pacify them?
Right. So there's options. Basically there's a lot of options. Firstly, we need to make them feel comfortable. We need to tell them we're not going to hurt you. We're here to resolve your issue, resolve your problem. Unfortunately, most patients come in when they're already in pain. So already the anxiety levels are high. So we need to just calm them down. We need to try and tell them that we're going to start. We're going to remove your pain, and that's what they want to hear. And we give them a anesthetic gel, and then give them an injection. And we try to make them as comfortable, try to distract them. Other options that we can do, like if patients have too much of anxiety and they can't sit, which we see, you have nitrous oxide, which is a laughing gas. This is a mild sedative that is inhaled through a mask. It helps patients relax during the procedure, and its effects wear off very quickly afterwards. Patients also, oral sedation just involves taking a prescribed sedative pill before the dental appointment. The patient will be in a awake state, but in a state of deep relaxation. They will need someone to drive them to and from the appointment. You get intravenous sedation, whereby a specialized anesthetist or trained dentist would inject you into your blood, and the patient would have no memory of the procedure. This is typically administered by a trained anesthesiologist. This is a deeper level of sedation. And then the last option is general anesthesia, where we have to take the patient to a hospital setting and do procedures because of extreme anxiety we couldn't manage in the chair.
Doc, the world of medicine is evolving and it just fascinates me. And how do you stay up to date with the latest developments and advancements in dentistry?
Okay, we're fortunate here in Pietermaritzburg that we have a CBD, professional dental development learning every month at Midlands Hospital. So we attend those meetings every month, and they keep us up to date. They get lecturers and professors from abroad or from out of town to explain and tell us the latest technology and what they do and how we can better our practices. So the CBTs, we attend the CBD meetings. There's dental conferences that we attend and online, and we try to keep up to date with as dentistry is evolving, and we want to be up to date and give our patients the best care.
Yes, fabulous. And how do you think dentistry will evolve in the next 5 to 10 years in terms of changes? And what are you excited about?
Digital dentistry is fundamentally transforming dental practices by enhancing precision, efficiency, and patient experience. It's what I'm very excited about is basically the 3D printing, whereby the patient comes in. Before they had to come in, we had to prep for a crown, send it to the lab a week and a half before we can give the patient the results. Now, with CAD/CAM, computer-aided dentistry, computer-aided milling, you can actually do an intraoral scan, scan the patient, send it to the lab, and you can actually give the patient the crown same day. So the patient comes in with a missing tooth, and you can actually replace the tooth the same day. So it's improved patient experience. Digital impressions are more comfortable than traditional impressions, so there's no longer a gag reflex. The ability for patients to visualize the treatment plans in 3D helps patients understand their options, make them more active in their treatment, and showing them before you actually start treatment, you actually show them what we can achieve and how we can achieve it. So the efficiency of digital workflow means less time in the dental chair, and it's very precise and very accurate. So this is what's exciting about the technology.
And Doc, can you elaborate a little bit about braces? I know as a teenager is growing, they get advised to go to visit a dentist and get those pearly whites sorted. Can you just touch base a little bit about that?
Right. Basically, what I'm more into is interceptive orthodontics. So basically, we identify problems early on, mixed dentition stage, where the patients have their baby teeth and permanent teeth. Usually, the cases that we see would be a crossbite, whereby this crowding, lots of arch space because the patient lost their primary teeth at an early age. And when they lose the primary teeth, the teeth move around because that's why we have top and bottom teeth. We have occlusion. So if you lose teeth before the time, the baby teeth are guiding the permanent teeth to be in place, to basically to come out in the correct position. So if the tooth is lost early, prematurely, we would get drifting. And once we get drifting, we get a space. We lost a space in arch. So we need to place a space maintainer. So this is interceptive in orthodontics. We place the space maintainer to keep the space for the permanent teeth, because he may have lost the tooth at the age of 5, and the next permanent teeth is only going to come at the age of 9. So we keep the space for the permanent teeth and do not lose arch space. Cross bites. This happens whereby we have not in line. The permanent teeth that erupts are erupting in out of the arch, and we try and sort this out in the beginning by creating arch space, by expanding the arch. And then a lot we see is jaw problems. A patient would come in, a 9-year-old, his front teeth look forward, and the mother will come in and say, please, my child's teeth is protruding. And besides that, it also gets accidents, because when your teeth are protruding and not in line, they can have chips and cracks, and it's more easily to get injured. Then we would look at the patient and we would see what growth spurt he is. So we would try to use the growth modification, a myofunctional appliance to correct the growth. So what usually we see is the lower jaw is lagging behind and the upper jaw is growing faster, which we explain to the parents, and parents think, no, it's correct the upper jaw. We actually need to correct the lower jaw to speed up the growth and reduce the growth on the upper jaw. So when we put appliance like a twin block, we actually allow the lower jaw to increase, be using the growth spurt with an appliance to move the jaw forward and delay the growth of the upper jaw. And this helps correcting the jaw problem. However, we will not be able to correct the teeth problem at that point, and we have to wait for a phase 2, which would refer to the orthodontist to perfectly align the teeth. So a lot can be done at a young age, and this could save the child from surgery, from more expensive orthodontic treatment.
Wonderful. So it's so nice to actually hear there is advancements, there's solutions to actually maintain our teeth. Listeners, don't forget, as Doc mentioned, you need to actually change your toothbrush as frequently as possible. With myself, Shabnam Ismail, you're connected to the Pulse Show, connecting with you on the health topic regarding dentistry. So we're going to take an advert break, and when we come back, we'll be diving deeper into the world of dentistry with Dr. Tar Ali. So don't go anywhere, and we'll be right back with more fascinating conversation.
صل وسلم على المصطفى محمد نور الهدى سيدي ومن بعده الأربع الخلفاء محمد نور الهدى سيدي ومن بعده الأربع الخلفاء لك الحمد يا ربنا وكفى فصل وسلم على المصطفى وآل وصحب كرام له هم السابقون وأهل الوفا وآل وصحب كرام له هم السابقون وأهل الوفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى هو المجتبى من هدينا به فيا رب زد أحمدا شرفا هو المجتبى من هدينا به فيا رب زد أحمدا شرفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى فإن القلوب تهيم به وإنا نذوب به شغفا فإن القلوب تهيم به وإنا نذوب به شغفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى بطه تطيب الحياة لنا ويرجو به ذو السقام الشفاء بطه تطيب الحياة لنا ويرجو به ذو السقام الشفاء لك الحمد يا ربنا وكفى فصل وسلم على المصطفى صلاة تكون شفاء لنا وأجرا وعافية وصفا صلاة تكون شفاء لنا وأجرا وعافية وصفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى محمد نور الهدى سيدي ومن بعده الأربع الخلفاء محمد نور الهدى سيدي ومن بعده الأربع الخلفاء لك الحمد يا ربنا وكفى فصل وسلم على المصطفى وآل وصحب كرام له هم السابقون وأهل الوفا وآل وصحب كرام له هم السابقون وأهل الوفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى هو المجتبى من هدينا به فيا رب زد أحمدا شرفا هو المجتبى من هدينا به فيا رب زد أحمدا شرفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى فإن القلوب تهيم به وإنا نذوب به شغفا فإن القلوب تهيم به وإنا نذوب به شغفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى بطه تطيب الحياة لنا ويرجو به ذو السقام الشفاء بطه تطيب الحياة لنا ويرجو به ذو السقام الشفاء لك الحمد.
Assalamu alaikum wa rahmatullahi wa barakatuh to the listeners on this beautiful Saturday morning on Radio Al Ansar 90.4 MPT Marisburg, 105.6 FM. You are with myself, Shabnam Ismail, on the PT Marisburg Pulse Show, capturing the heartbeat of the community. Smile bright. Today we are tackling and talking about dental care and our teeth. And with me is Dr. Tar Ali, a dedicated dentist passionate about helping people achieve optimal health. Assalamu alaikum, Dr. Ali.
Wa alaikum salam wa rahmatullahi wa barakatuh.
So, doctor, tell us, how are advancements in digital dentistry changing the way dentists diagnose and treat patients?
Digital dentistry is evolving. it makes dentistry, it makes our lives very much easier as we are able to interact with the patients. We are able to show them on a screen before actual treatment is done. You scan their mouth. It's an intraoral scanner. You scan it. They are able to see right there and then the whole entire mouth, the mold, their teeth, and we can show them what problems, there's cavities, the teeth are not straight, and we can show them and interact with them and tell them this is what we need to do and this is how we're going to. And we can, it's a smile design. We can actually show them what are you not happy about, tell us, and we can actually sit on the PC and design for them a smile what they would want. It's very difficult to obtain what they want, but we can actually get very close there. And precision, it's very precise, very accurate, and we can achieve all this because of the technology.
And lasers, can you elaborate how would that actually benefit the patient?
Laser dentistry is basically more for gum contouring. It's help with tooth whitening. It's basically minimally invasive. It also, you can do small cavities whereby you don't have the sound of the drills, and it's more. It's basically it keeps the area very sterile. It's very patient friendly. Patients like this. It's new technology, and I think it's gonna become more in use. It helps. You can do it for root canal cleaning, disinfecting of the root canal, for gum contouring, for people that have gummy smiles. You can actually remove excess gums and make the teeth look longer. It's minimally invasive, very friendly for the patient, and patient like this.
And tell us, obviously, a cleft palate in terms of the management and the dentistry in that regard. Can you enlighten our listeners how would they manage a
Yeah.
patient with cleft palate?
Basically, cleft lip and palate are amongst the most common birth defects, affecting the formation of the upper lip and the roof of the mouth. Managing patients with cleft palates requires a multidisciplinary team approach involving the oral and maxillofacial surgeons, which they need to do the surgery to close the cleft lip and palate, orthodontists, because you have a lot of teeth crowding, you have malalignment of teeth. You need speech therapists to teach the child now to speak properly. ENTs, because they have a lot of issues with the ear, the eustachian tube, and general dentists is just there for psychosocial support to play the role in supporting the patient's overall well-being, addressing the not just the physical but also the emotional and social aspects of living with a cleft palate. So clinical problems are there, and it's a birth defect, and it's caused by genetic and environmental factors. Maternal smoking, the cause of this, so it's a problem, and it affects a good percentage of people, and it needs to be managed correctly.
So, doctor, let's talk about a very sensitive topic. I mean, losing teeth can be a challenging experience, especially for our elderly patients. Can you share with us what you observed about the emotional impact of tooth loss on your patients and what solutions you offer to help them regain their confidence and quality of life?
Absolutely. This is an important and often overlooked aspect of dental care. Losing teeth can be a deeply emotional experience, especially for the elderly. Beyond the physical discomfort and functional limitations, I observe that patients feel a profound sense of loss, not just of teeth, but of identity, independence, and confidence. Simple pleasures like eating favorite foods, speaking clearly, or smiling can be a source of anxiety and embarrassment. I've had patients who stopped attending family gatherings because they were too ashamed of their smile. Understanding that emotional impact is essential to providing compassionate care. We need to offer practical solutions and emotional support. Discussing treatment options like dentures, implants, or fixed bridges. We need to explain to the patients what we can offer them, and we need to regain their aesthetics and functions. Because when you lose teeth, your lips and your mouth sunks in. So dentures are able to restore this aesthetics of the patients again. So you have full upper and lower dentures, complete dentures. That's for patients who've lost both upper and lower teeth. You get partial dentures, patients that have lost some teeth and it has affected their function. And you get implant supported dentures, whereby you place an implant and you support it with a denture, which gives it more stability. Now, it takes time also when you do dentures for patients. It takes time for them to adapt because it's a new thing. and it's difficult initially for the patient. So we would expect 2 to 4 weeks for patients to get used to this. Patients complain when they chew, it falls. So we need to explain to patients that the denture is not attached to your bone; it's attached to your gums, and it's not attached to teeth; it's attached to your gums or your bone. And the main suction that we're achieving is with your saliva. And unfortunately, with older people, their saliva is reduced because of medications that they take, antihistamines, depressant drugs, hypertension drugs. So saliva flow is reduced, and this is another problem that we face with dentures. Another problem with dentures is the denture, as you using your muscles. So dentures can slip and fall when the patient talks or laughs aggressively. So we need to teach the patients that you need to manage and how to control your muscle. So it takes time to adapt. Usually we're very successful if the ridges are fine and good with dentures. Patients adapt well and restore their confidence and function. Another aspect of how to clean the dentures, we need to explain to patients that they need to take care of their dentures. They not now you've got dentures, you also need to brush your gums, you need to brush your palate, still need to brush your tongue, and you need to clean your dentures and brush it with a soft bristle brush. You can't use toothpaste on the denture because it's too abrasive and it can cause scratches. And you need to remove your dentures at night, because if you don't remove your dentures at night, you get fungal infections, you get soreness, you get pain. So dentures need to be removed at night, kept under water, kept in a container with water so they stay moist, and it needs to be cleaned. You get denture cleaning materials, and they should use that.
So, Doc, can you give us a few tips for the elderly of what they can not eat to maintain those pearly whites? Because, I'm just referring to things like biltong and hard foods. I mean, you wouldn't want to lose a tooth. In your experience, what would you suggest?
Patients that have fillings, usually when they have something very sticky, like a sticky candy, biltong, you usually can actually break off your filling with aggressive pull. Fillings are not that strong like normal teeth, however, so they have to be careful and avoid sticky and hard foods. Elderly, usually we see a lot of problems with elderly is over the years of traumatic tooth brushing. So they get a lot of gum recession. They've got the gums are higher up because of aggressive tooth brushing. So it's important. I mean, at that age now, they used to that. You can't. So we need to change that and advise them. Then the option is to get a soft bristle brush and to gently brush their teeth and not aggressively brush their teeth. And that's one of the major problems we see with elderly. Reduced saliva, so they're more prone to cavities, they're more prone to gum disease. So they can have saliva substitute or chew a sugary sorbitol chappy to stimulate saliva flow.
And Doctor, to our youth who would like to actually get into the career of dentistry, what is the best part of your job, and what advice you will actually share with them?
Dentistry is art and science. You have to like to interact with people. You have to like to make changes to people's lives. You have to have an eye, and you have to have fine dexterity skills. So you got to practice this, and it's a beautiful feel. I mean, it's over. You get fulfillment.
MashaAllah, and Alhamdulillah for all the great work that you're doing out in the community. Jazakallah, Dr. Ali, for sharing your valuable insights on dental care and hygiene. Do you have any closing remarks or messages to our listeners on how they can get in touch with you?
Thank you for having me on the show today. It's been a pleasure discussing the vital connection between oral health and overall wellness. I hope our listeners have gained valuable insights into how they can better care for their how they can take better care of their oral health and by extension their general well-being. We are situated in 366 Burgess Street. Listeners can come in for a consult and whatever concerns they have. We work 7 days a week, Monday to Sunday. Sundays by appointment. We do also offer after-hour services, so they can contact us on our WhatsApp number 082 611 7867, and we would like to bring about a change, and we would like to do the best that we can do and restore your health and function. And we would hope you're most welcome to consult. with us.
To our listeners, shukran for tuning into today's episode of the Pulse Show. And we hope Dr. Ali's expert advice has truly inspired you, as it has inspired me to change your oral health and make a difference with your teeth. Remember to prioritize your health and well-being. Jazakallah to our technicians, both Pietermaritzburg and Durban. Until next Saturday, inshallah, stay healthy. And remember, your health is your priority. Jazakallah to all of you. Have me and my family in the du'as. It's a wrap on the Pietermaritzburg Pulse Show from myself, Shabnam Ismail. Assalamu alaikum wa rahmatullahi wa barakatuh.
وأهل الوفاء وآل وصحب كرام له هم السابقون وأهل الوفاء لك الحمد يا ربنا وكفى فصل وسلم على المصطفى هو المجتبى من هدينا به فيا رب زد أحمدا شرفا هو المجتبى من هدينا به فيا رب زد أحمدا شرفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى فإن القلوب تهيم به وإنا نذوب به شغفا فإن القلوب تهيم به وإنا نذوب به شغفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى بطه تطيب الحياة لنا ويرجو به ذو السقام الشفاء بطه تطيب الحياة لنا ويرجو به ذو السقام الشفاء لك الحمد يا ربنا وكفى فصل وسلم على المصطفى صلاة تكون شفاء لنا وأجرا وعافية وصفا صلاة تكون شفاء لنا وأجرا وعافية وصفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى محمد نور الهدى سيدي ومن بعده الأربع الخلفاء محمد نور الهدى سيدي ومن بعده الأربع الخلفاء لك الحمد يا ربنا وكفى فصل وسلم على المصطفى وآل وصحب كرام له هم السابقون وأهل الوفاء وآل وصحب كرام له هم السابقون وأهل الوفاء لك الحمد يا ربنا وكفى فصل وسلم على المصطفى هو المجتبى من هدينا به فيا رب زد أحمدا شرفا هو المجتبى من هدينا به فيا رب زد أحمدا شرفا لك الحمد يا ربنا وكفى فصل وسلم على المصطفى فإن القلوب تهيم به وإنا نذوب به شغفا، فإن القلوب تهيم به، وإنا نذوب به شغفا. لك الحمد يا ربنا وكفى، فصل وسلم على المصطفى. بطه تطيب الحياة لنا،